Hi, I'm Dr. Mark Bieszka. I'm a general surgeon at Muskegon Surgical Associates. So today I want to talk to you a little bit about hernias. Hernias are a very common ailment that many people deal with. We as general surgeons operate on hernias almost on a daily basis. I figured let's start with a little anatomy lesson because that can help you understand what a hernia is and how we can fix it and how we can help you feel better. So the abdominal cavity, which is typically where we see hernias, you can get them anywhere on your abdominal cavity, from the upper part, down at your belly button, or even down in your groin. The reason you get a hernia is because of a tough substance that encircles your entire abdominal cavity called fascia. And what happens is this fascia will get a hole in it, which allows things from inside your abdominal cavity to come to the outside. The symptoms that you may have with a hernia, some people will just have a bulge that's unsightly. Some people may have a lot of pain in a certain spot with no bulge, and some people will actually have a bulge and a lot of pain in the same area. Typically, hernias will come on when people are doing strenuous activity, like you're lifting up a couch or taking the trash out, or even just dancing at a wedding. You know, people get hernias for any and all reasons, but they can be very uncomfortable, very painful, and it's something that we can easily fix as general surgeons and get you feeling back to your normal. So let's talk a little bit about how we fix hernias. Okay, there's multiple ways to fix a hernia. Typically, what we do is we make a little incision over the top of the hernia. We push everything back into the abdomen where it's supposed to be, and then depending on the size of the hernia and its location, we'll either put a piece of mesh in there or we'll just close it with a special surgical suture. Okay. Sometimes, depending on the hernia and its size, one of the things that I really like to do is I actually use robotic surgery to fix the hernias. With the robotic surgery, it's a fancy machine. If you want to look it up on the internet, it's made by Intuitive. It's called the Da Vinci Robotic System. What I do is I go in through little poke hole incisions in your abdominal cavity. I find where the hernia is. I pull everything back into the abdominal cavity, and then I place a piece of mesh in there to reinforce the area. Some of the benefits of doing it robotically: the incisions are typically much smaller, your pain is typically much less, and you'll get back to your normal activities much sooner. With that in mind, why don't we talk a little bit about your recovery after surgery. So typically with hernia surgery, it's a day surgery. That means that you come into the hospital, I do the surgery, and you go home the very same day. You don't have to stay overnight. There's not a lot of preparation on your part, which is nice. You get back to your own comfortable bed instead of being at the hospital. So next, let's talk about some of the post-operative care. Like I said, you will come in and go home the same day with surgery. Okay, immediately after surgery, because of the anesthetics that you get, you're going to be quite groggy and tired, and that's okay. Get a good night's sleep and kind of start your day the next day. You are going to be very sore. The area that we fixed the hernia may feel somewhat the same as it did before, but this should rapidly improve over the next few days. In general, you're going to be quite sore for about a week or two. After about 4 weeks, you'll pretty much have complete resolution of the symptoms. The body takes about 6 to 8 weeks to completely heal from any type of insult, whether it's surgery, trauma, or even just cutting your arm. It'll take about 6 to 8 weeks to completely heal. With that in mind, after surgery, I typically have people on a 10 to 15 pound weightlifting restriction for about 4 to 6 weeks, depending on the size of the hernia. The reason I do this is to help reduce the risk of a recurrent hernia. Those are some of the basics about hernias. Every person and every hernia is different, and I want you to know that if you come here and see me at Muskegon Surgical Associates, we will tailor a plan specifically for you to get you feeling back to your best as soon as we possibly can. So if you'd like to talk about hernias, feel free to come on by, give the office a call, and just ask for Mark Bieszka, and I'm happy to help you.